All right, I'm just gonna check my provider orders. I have here that I'm gonna be doing a PCA pump with morphine for Steve Rogers. Concentration at 25 milligrams of morphine and 25 mils of solution. Basal rate 1 milligram per hour, demand dose 0.5 milligrams every 15 minutes. Okay, wonderful. So, making sure that order is going to be okay. So I'm just going to do PCA pump. I have all of my supplies here. I have my morphine medication. It says morphine sulfate. It's a 1-to-1 concentration. PCA dose, and it's not expired, and it's going to be for Steve Rogers. Perfect. So, and it's the right medication, right dose, right route, right patient, right time, and it's not expired. Wonderful. And I got my tubing, alcohol prep pads. I'm ready to go. Okay. Hello, good morning. My name is Elise. I'm going to be your nurse today. Can I have you verify your first and last name and your date of birth for me?
Steve Rogers' birthday.
Okay, wonderful, perfect. All right, Steve, I have an order here to do a PCA pump today. So PCA pump is a patient-controlled analgesic. So pretty much it's just going to help control your pain. So it seems like you've been in a lot of pain. What would you rate your pain scale at right now between 0 to 10, 10 being the worst?
Probably an 8.
An 8? I'm so sorry you've been in so much pain. Let's try and bring that back with the PCA pump that we're going to be setting up, giving you some morphine. What's a good pain goal to set to bring your pain down? You think like a 2 or a 3 is good for today?
I think that'd be a good goal.
Wonderful. Okay, awesome. Well, let's get started. I'm going to take your vitals. I'm going to check your oxygen. Oxygen's good. I'm going to check your respirations. Respirations are between 12 and 20, so everything's looking good there. Good to start. Just a quick question. Do you have any allergies to medications at all?
No.
No? Wonderful. Okay, then I'm going to go ahead. I'm going to check your IV site and patency, and then I'll get everything set up. Let's grab some gloves. My slides closer. Gonna have gloves and a flush. So I'm just checking my IV site here. There's no redness, no swelling. Steve, is there any pain in your IV site?
No.
Okay, wonderful. So it's clean, it's dry, doesn't look like it's infiltrated or anything. If it were, I would remove it and place a new one. But everything's looking good for today. We're just gonna check patency real quick. So we're gonna scrub 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so I scrubbed it for 15 seconds or 30 seconds. 2, 30, 3, 4, 5, 6, 7, 8, 11, 12, 13, 14. Another 15 seconds. So scrubbed it for real good for 30 seconds. I would let this dry. And then I have my flush. Okay. It's flowing really nicely. Wonderful. Just gonna clamp that off. Okay. Alrighty, now that I've seen that this is patent, I'm gonna get everything set up for my morphine. So I have my lines here. So I'm going to prime. I'm gonna prime this first section here with saline. Gonna clean off all the lines, just make sure everything's good. I'd clean them all off for 30 seconds. Okay, going to flush this first little tiny Y with saline. and clamp it. And then I would have like a little green connector to put on top of this, but just to ensure that there doesn't get any air bubbles or leakage, I'm just gonna leave the saline flush on there. And then I'm going to flush with morphine. Since it touched the floor, I'm just going to scrub again, 30 seconds. I'm gonna simulate scrubbing this for 30 seconds for the sake of time. And I'm going to connect my morphine and make sure that this is still the same correct patient, correct medication, correct dose, correct route, and it's not expired, and make sure that's going to be going into the right site, PCA. Okay, so I'm now going to flush this through and try and make sure that I'm not going to lose any of that morphine medication. So I'm just tracing it on the line and seeing that it is all the way. There you go. Completely flush with morphine now. I'm gonna clamp my lines. Alrighty. Now we're ready to set up our morphine infusion. So at this point, I would have a second nurse with me to go over the PCA programming process, make sure that I am programming it correctly. Okay. Just going to let's make sure that this thing is on. Okay, while that is turning on, I'm going to connect this to the patient while I program. So I'm going to scrub both sides for 30 seconds. Okay, both sides are clean. I'd let them dry and then I would connect. Okay, so now I'm going to be setting up my pump. Okay, so I'm going to channel select. Confirm the right time. We're going to do monoject to 60 mils. It's going to be our morphine for acute pain here at the hospital. It's 1:1 as it is here in our orders, the concentration, as well as on the vial, it is 1:1. Yes. Okay, I've already monitored his respiratory status and his oxygen saturation at the beginning when I took his vitals. So confirm. We're going to attach an O2 monitor now, and because we want to be monitoring his respirations and his oxygen, make sure that he does not go into respiratory depression. But for the sake of this, we're just going to simulate. I've already done this at the beginning with his vitals, and I would continue to check up on him after starting of the PCA pump. Okay, so I have the correct concentration here. We're going to be, okay, next. So I have, it's just wanting me to confirm all of my limits and everything. I have that here at the orders. So we're going to be doing a PCA dose in continuous with our basal rate and demand dose. Okay. So with this PCA dose, he is going to get 0.5 milligrams, as it says here, every 15 minutes. So making sure that's the correct here with our orders. Continuous dose is correct. You're having here at 1 milligram per hour, as we have here with the basal rate. And then our max limit is going to be 3 milligrams per hour. So let's change that to 3 milligrams per hour. Confirm. So it says that the max dose could be higher, but we're just going to continue because that is what the provider ordered. Now I'm going to just lock the door. Take the key. I will take the key with me. Don't want to leave it in the room. And then before I press start, just want to double verify with my nurse. Is everything correct?
15, 1, 3. Yes.
Wonderful. Okay, now I will press start. Okay. Steve, thank you so much. You did such a great job. I just want to educate you on some things. Oh, I need to make sure all my lines are open real quick. Okay. Steve, thank you so much for being so patient with me while I set that up. So some education things. This is a PCA pump. It is controlled by you. However, you cannot press the button more than once every 15 minutes. Family should not be pressing the button. Even if you're sleeping, you are sleeping and you are sleeping peacefully. So we assume that you're not having pain if you're able to sleep. So there's no need to press the button or have anyone press the button while you are sleeping. This is the button that you will be pressing. I'll put that right by your hand. Some other things to note, it can cause some, obviously, like make you feel loopy. It can also decrease your breathing. So if you start to feel like really out of it, or if you have like decreased breathing and all that stuff, or if family notices anything, just go ahead and press that red call light button. That's the main call light button with the bed. I have resuscitation stuff on standby in your room, as well as naloxone. So we will do that if we notice any overdose symptoms or concerns. Yeah, if you don't notice any improvement with your pain after pressing your PCA dose and waiting a few minutes, if you're not seeing any improvement, press that red call light button. I can come in here and we can talk about some non-pharmacologic therapeutic pain management activities to help minimize your pain. But if you're still not seeing any improvement, we can definitely then consult with the provider for your care. And some other things is if you notice any like allergic reaction, I know you mentioned you didn't have any allergies, but if you do notice an allergic reaction, swelling of the throat, feeling itchy, hot, anything like that, please press that call light button. We'll stop the morphine and give you some epinephrine, and or just kind of help reverse those side effects. And also with the overdose, we would stop the morphine before doing all the resuscitation and naloxone precautions. So if you don't have any other questions for me, I'm just going to check your bed, make sure it's low, it's locked, call light is within reach, side rails are up. I'm going to go ahead and document, but I will be in with you every hour, just kind of like check and monitor, make sure that things are going good. Does that sound good? Mm-hmm. Alrighty, you have a great little moment to yourself, and I'll be back to check in with you later.